Okay, we're recording. Can you just say hi and?
Hi, my name is Ejike Onewu, and I had surgery last week, and this is 1 week.
One?
Today, tomorrow.
6 days. Tomorrow is 7, right?
Yeah, and lost about 22 pounds. I don't think that's right, but
It can't be right. It must be one of those magician tricks at Las Vegas, right?
Exactly.
Dr. Rutledge has been tricking me on these scales.
Exactly. So, but I'm sure it's probably half water, but but that tells you how hard my heart was pumping, into. So.
Right. Your week has been okay. He's been doing all right.
Yeah.
You had some aches and pains and some tiredness, and the cranberry juice. So you want to talk about your cranberry juice event?
Yeah, cranberry. I kind of, on Super Bowl Sunday, I normally would drink.
Thought you'd get crazy and drink cranberry.
Exactly.
You're wild. Okay.
So I did a little bit too much of the cranberry juice too fast, and I didn't really realize what was going on. But
That was right when Plexico Burris caught that pass.
Exactly. Yeah. So I did that, and I felt like I was coming down with a fever or something, but then I just laid down for like an hour.
So you drank, how much would you say? Let's, for other people on the internet, for users, you're sitting there calmly watching TV, and you decide to drink some cranberry juice. And how much did you drink, and how fast would you say? A whole cup?
Yeah, about 3, but in over a period of time.
How long?
Like 40 minutes.
Okay, so you had 3 cups of cranberry juice.
Cold cranberry juice.
A cold cranberry juice over 45 minutes.
Yeah, and it was in a bar at the Bellagio, so it was in a bar there. So I thought it probably was the smoke too. I'm not sure if that did that.
And after that, you felt woozy and tired?
Yeah, I felt kind of tired and weak and kind of sick. But
Is there a negative with cranberry juice?
No, I don't think so. I think that anything too fast in the days after surgery can kind of upset your stomach because it's like a newborn baby. It's been stapled and sewn, and so if you take a lot of anything fast, it can kind of cause a little bit of a bump in your sugar, but then a drop, and you could get a little kind of the weak and dizzies or tiredness. And then if you let that pass, you should get better. Anything in the first week is just to think about it. Most people who have this kind of surgery are in the hospital for several days before they leave. And in the olden days, when I did this surgery open, we'd be in the hospital for a week. So this is very radical to be home a couple of days later, to be in a hotel, to be out and about. Your other, compatriot from last week, I mean, he went to Boulder Dam. We've had people go on the helicopter tours and everything right away. So it's not surprising if you're out and about, you get a little bit up or down on your fluid, or you take a little bit in too fast or too slow. It's never really dangerous, but it's just something to be aware of, to be cautious of, because if you're a little cautious, you should do without any problems.
yeah. So, Joe, apart from that, everything was smooth. Don't even feel like I had the surgery, honestly.
Pardon me?
I don't even feel like I had any surgery.
I can see that. That's on the front page of the website. Questions? Anything that's unclear that we had to go over our instructions or?
Not much. I think I figured it out.
Okay.
Now the Pepto-Bismol. How do I have to do that? Because I figured out that I don't really have any pain. Like I don't.
Right.
I probably, like you said, I don't even have nerves in my stomach that I don't feel it. So
Right.
I don't know. Is there any damage being done there that I need to take Pepto-Bismol?
Yeah, let's talk about that.
But it doesn't hurt me. I don't feel it.
That's a good question. There are some medicines that are in your list that are antacids that are not there for pain relief, but are there for prophylaxis or protection. We know that we have crushed and stapled and sewed upon your stomach. And now it's trying to heal up in the midst of being bathed by digestive juices and acid and bile and enzymes. Well, that's a hard job to ask it to undertake, to heal in the midst of a vat of hydrochloric acid. So what we found is that some people can actually get an ulceration there and have trouble healing it and have problems. Even if you don't have that now, just like we have everybody who gets in the car wear their seatbelt to protect them, we recommend that these antacids be taken. They don't have to be forced down, you don't have to make it religious, but we feel like that some protection against the acid and the enzymes while your stomach heals is a reasonable precaution. So if you're choking down and fighting a Pepto-Bismol, or you just don't feel like it, or you're out and about and you skip a dose, don't worry about it. Don't be very rigid pretend that the pharmacy orders that say you take it every 4 hours or whatever are very flexible on that. If you miss a dose, you skip it.
Okay.
On the other hand, over the next 3 months, the addition of moderately regular Tums with some calcium in it as an antacid, the Prilosec, and the Pepto-Bismol with the bismuth in it, we think will help protect you from having a problem with ulcers in the future. And again, ulcers are our biggest problem. We don't want those. And the bismuth actually kills the bad bacteria. And the bad bacteria that causes ulcers has a name. It's Helicobacter pylori. Helicobacter pylori. And I mention that name because that bacteria has another claim to infamy. It's probably the cause of stomach cancer.
Yes. Yes.
So, if you're thinking about it, the Prilosec, the vitamins, the vitamin C in your orange juice, the bismuth, they all kill the H. pylori. They help protect you from ulcers and maybe could protect you 30 years from now from a stomach cancer. So for all those reasons, you probably should follow our advice, but not so rigidly that it makes it unpleasant or unenjoyable for the rest of your life.
I think too much information on the internet sometimes from people emailing and blogs and stuff. The capsules are fine, aren't they? The
Sure.
Pepto-Bismol and
Yeah, I just saw that.
The Benefiber will be for the Centrical. I remember you said something about the Benefiber pills.
Benefiber is
Uh-huh.
fine. The Benefiber has been a little tricky because the company that makes it initially made Benefiber out of something called guar gum. And there is some research that guar gum is good, but not nearly as much as some of the other fibers. Then they changed it to wheat dextran, which is basically wheat fiber, which there's lots of research on and I like.
Mm-hmm.
So Benefiber is fine. Think about fiber in this way. Fiber, good. More fiber, good. Can't have too much fiber. So any fiber that you can stand, that you can take, we would like you to take. And we would encourage you to take it.
And that's for how long?
Ever.
Ever. Okay.
Yeah. Even if you decide to have the surgery undone, all of us in here, surgery patients, non-surgery patients, visitors, support people, they say should be taking at least 32 grams of fiber a day. Now, if you think about that in pill form, that's 64 tablets a day. So there's no upper limit for a normal person getting anywhere near that. So we say take all the fiber you can, eat all the high fiber foods you can, because fiber is another thing that helps protect against ulcers and protects against stomach cancer. So eat a high fiber diet. And take some supplemental fiber. So you should, in a Ziploc baggie, when you go to work, in your pocket, in your fanny pack, in your purse, have a Ziploc baggie of some fiber tablets. And when you eat lunch, you open your Ziploc and you say fiber tablet, salad. Fiber tablet, spoonful of yogurt. Fiber tablet, apple.
All right. Other than that, the week went really smooth and nice. So
Good. Do you want to say a shout out? Did you say that the nurses take good care of you here?
Oh yeah, the nurses were perfect. Really great. Great nurses.
All right. Thank you for saying that. I appreciate it. I'll pay you later. Oh, you look gorgeous. Don't take that. No, the wounds look super. Doesn't hurt, I hope.
No, not at all.
Should we ask for a comment from the boss? Any thoughts, any questions that we should answer?
I just want to say thank you.
Aww.
Thank you very much.
Thank you very much.